Hello, I'm going to be talking to you about how to succeed during the clinical years. So first of all, you don't need me to tell you. You already know what to do. You've already been incredibly successful. You have gotten all the way to medical school, into medical school, and through your first 2 years. You're halfway done. Most of what I'm going to say here is common sense, things that you already know. However, I'm going to tell them to you because I see medical students making these errors all the time. I think part of what happens is maybe you get a little bit burned out, or maybe it's just slowly you start to change your actions little by little over time. And then the next thing you know, you're doing things that you never thought you would do. Wearing a dirty white coat, showing up late all the time, being disrespectful, right? Suddenly it becomes your normal, and it shouldn't be. So this is just a little reset, a little reminder of what we're expecting from you, of what you should be expecting from yourself. Dress professionally. If you don't know what it means to dress professionally, which at this point you certainly do, but if you don't, look it up, right? You want to wear your white coat every day with your name tag. Make sure you're wearing professional attire. Make sure your attire isn't too revealing, too tight in a variety of situations. You can bend over a patient, you can squat down to the ground. All of the situations you will still be respectfully covered. 80% of success is showing up on time. Show up on time, right? Being late once or twice because traffic was bad or because it's your first time getting to the location, no problem. Being late consistently, that is a huge red flag, right? That brings up huge professionalism issues. Even if you know that the doctor that you're working with is going to show up late, you still show up on time or early every single day. Very simple, very basic phrases, right? Be safe. Make sure you're working within your knowledge zone, right? You're going to push things a little bit. You're going to do things you haven't done before, but make sure you're safe in doing them, right? Speak up and say, I haven't done this procedure before. Can you please supervise me? Or, can I watch you do one first and then I'll do the next one? Make sure you show that you really want to do it, but be safe. Your own safety is more important than anything. Be kind and be helpful. You are an important member of the medical team. Act like an important member of the medical team. If you notice that some of the medical assistants are struggling, you notice that the residents are overworked, you notice that your preceptor seems a little tired and overwhelmed, ask what you can do to help and be helpful. I will say some of the best medical students who have come and rotated with me are the ones who can anticipate my needs, are the ones who realize, oh, she always gives a book to kids who come in with this situation, and they go and grab a book for me, right? Or they can anticipate what I need to happen. So be that person that can really help and be an essential member of the team. And yeah, come prepared, right? This is so important. With surgery, oftentimes you'll know which surgeries you're going to see the next day, or at least you have a high likelihood of seeing the next day. Read up on those ahead of time. Know the anatomy. Know what to expect. For all of your rotations, you could at least do a couple aquifer cases in the specialty before the rotation even begins, just to give you a little taste of what to expect. And then read up on the things that you've seen that day. It is so disappointing as a preceptor to ask a student about something and they may not know the answer. That's fine. That's why they're here, is to learn. But then I teach them about it, and maybe the next day or maybe the next week we talk about it again, and it's like the student never heard what we talked about, right? They never took that time to really process it and allow it to sink in. So take that time, read up, be prepared. What you're not going to do: show up with a dirty white coat. I can't tell you how many dirty white coats I see out there on medical students. It's something that you would think would never happen to you. And yet I think you get so used to wearing your white coat over and over again, you don't realize how dirty it becomes, right? The ring around the collar, the dirt in the pockets, even just, this is an extreme example, but even just dirt kind of smeared down it. definitely encourage you to make sure anytime your white coat gets soiled that you wash it. A habit that I got into during my clinical years was at the end of every rotation, I would take my white coat into the dry cleaner. So then I knew it was clean and pressed at the start of every next rotation. So whatever your system's going to be, make sure you are washing that white coat at least once a rotation, if not more, as needed. Don't look bored, right? You may not love pediatrics. You may know that you want to be an orthopedic surgeon, but if your pediatric preceptor senses that you're bored and not into it, that is going to reflect very, very poorly on you. Number one, you will get more out of the rotation. You will learn more, you'll feel better, and you'll feel more energized if you act like you actually want to learn from the rotation. One of the things that keeps us apart from other healthcare providers is our broad fund of knowledge. We have the opportunity and the gift to learn about all the different medical specialties, right? And your third and fourth years are really when you're learning that. So right now, this is your time to explore each and every field. I don't get a lot of phone calls from preceptors complaining about our students, but I will say that one of the biggest themes in the phone calls that I get is that the student just didn't seem to care. They didn't seem interested. You know, maybe they made some lapses of judgment that just showed that they were not into this rotation. Like I said, it reflects very, very poorly on you. So even if it's a specialty you don't think that you're interested in, now's your opportunity to learn about it. You're probably not going to have the opportunity to learn about this field ever again. So take the opportunity that you can, learn as much as you can. Be that awesome physician that no matter what pandemic is happening, no matter what situation you're in, no matter what, you know, island you're trapped on, you know that you're going to have some knowledge in everything and you're going to be able to help. Now's your opportunity to learn. And like I said, be on time. Please be on time. It is such a huge red flag if you're showing up late all the time. If you need to leave early 1 or 2 days because you have an appointment or you have something going on, you check with your preceptor well in advance, no problem. If you're asking to leave early most days, that is a huge problem. That is a red flag. You should be showing up before your preceptor does every single day. And then you should be staying at least until the end of the day, right? At least until the preceptor is there. Sometimes, and this is a little bit of a fine line, but you guys will be able to walk it without a problem. Sometimes preceptors will let you go early, right? Or the residents will say, you can go ahead and go, right? And maybe it's only 3 o'clock or maybe it's 5 o'clock, but you know that they're staying later because you've had a really busy day. So then you ask, is there anything I can do to help? And if they say no, then you leave. Leave when you're told to leave, right? Check and make sure there's nothing else that you can do to help. But then it's perfectly okay to leave. Sometimes it can be a little bit annoying, cumbersome if the medical student is hanging around and now you feel like, oh, I have to take care of your needs while I'm just trying to finish this stuff up and get out of here for the day. If you're the smartest person in the room, then you're in the wrong room. I teach by asking questions. That's one of the ways that I realized that I learned best, right? I learned best with the preceptors who challenged me and who asked me questions. And I felt that pressure to be able to answer their questions. And so when I have students working with me in the clinic, I will ask them questions, right? And find out what they know about this. You know, tell me about the different viral exanthems. Tell me how this one starts. Tell me this. I have had students who have gotten very, very upset, right? Students who have even cried, even though I'm asking questions in a polite manner, but who have cried because they feel so disappointed in themselves and frustrated with themselves because they can't answer the questions. And here's the thing, it's a huge frame shift that is so important for you guys to do. You guys don't need to know everything. The whole reason that you're doing these rotations is to learn. So if you're getting the questions wrong, you are exactly in the place that you need to be in, right? And that's something that I tell these students. I don't want you to know all the answers. If you know all the answers, then I have nothing to teach you. When you don't know the answers, then I can teach you, you can learn, and then you'll know these answers, right? So don't put that pressure on yourself or that expectation that you should know everything. Each rotation you're gonna learn a ton from. So have that expectation you're gonna learn a lot from. If your preceptor asks you a question and you don't know the answer, do your best to answer it, or say, I don't know, but I'm gonna look it up, and then actually look it up. The capacity to learn is a gift. The ability to learn is a skill, and the willingness to learn is a choice. So true. Like, I'm going to read it again just so you can have it sink in. The capacity to learn is a gift, and that's a gift that every single one of you possess. The ability to learn is a skill, right? Also, you all possess that skill. And the willingness to learn is a choice, right? And that's where you're bored because you're not into this rotation, and suddenly you're not learning anything. Your preceptor's frustrated, you feel disengaged, and you're doing poorly on the COMED exam and on the COMLEX in those subject areas. Your willingness to learn is going to exponentially expand the places that you'll go. Be open to learning everything. Things that you should bring with you on every rotation. First and foremost, your mindset, right? Your positive attitude, your optimism, your confidence, right? That frame shift of you may not be the smartest person there. You may not know everything, but you're there to learn and you're excited to learn. This is something that I got in my fourth year that I absolutely loved. There are things called white coat clipboards. So it folds and it can fit into the pocket of your white coat. It has a bunch of useful information on it. You can put some papers on there. Really handy if you want to take notes. Something that I always appreciate is when I'm doing learning sessions with students in the clinic is if they're take notes, right? There are some students who will just talk to me as I'm doing my educational session, but they don't take notes, and I know that they're not going to remember it. I know they're not going to look up the information afterwards. So taking notes is a great way to show your preceptor that you're engaged. Pens, right? Always bringing pens and extra pens. That is definitely one way you can be a helpful member of the team, is by having pens with you. Definitely your stethoscope, your name tag, and your white coat. And then this is another book that I love too. I don't know how many of you have already looked at this book, but Boards and Wards is really helpful. Kind of gives you that bird's eye view and a really great overview of almost all of the specialties. Review the syllabi, right? In our syllabi, include topic lists. So things that you know that you should learn. Include the list of log items that you need to have. If you print those 2 items and bring them to your preceptor on your first day, I can almost guarantee your learning experience is going to be so much better. Because sometimes the preceptor will look at you and say, so what do you want to talk about? And you'll go blank, because that is just common human nature, and be like, I don't know, what do you want to talk about? And they'll be like, is there anything you need to learn, right? And it's so hard for you to think. If you bring these topic lists and these log lists, and even if you don't give them a copy, you keep it on that clipboard or you keep it in your white coat pocket, at least you have it and you know that there are things that you can do. Some of our best preceptors really look at those lists and say, oh, I see that you haven't yet given an immunization. Let's have you follow the immunization nurse. Or I see that you're expected to learn about this topic. Let's talk about this topic. So it can be a really great way to make sure that you are structuring your learning in a way that's productive and best for you. There are also a bunch of reading assignments. So if you get home at the end of the day and you're not sure what you should look up or where you should look it up, look at our syllabi. We have really curated a fantastic list for you. And I can say this, especially having put together our online core rotations, using our topic lists, our log lists, and our reading assignments really helped me to structure out every single day of the rotation. So you can even look at those if you want to get an idea of, okay, on this day, what should I read? Ideally, you're reading about what you saw that day or what you know you're going to see the next day. But if you need just, you know, a structured setup, we definitely have that for you. And then before you leave each day, one of the things that can be very disappointing as a preceptor is when you ask, so do you have any more questions for me? And the student says, nope. And then suddenly you're thinking, we saw 30 patients today and you don't have any questions, right? Make sure for each patient that you're seeing that you're taking notes for yourself, things that you can look up on your own, but also if you have that opportunity to engage with your preceptor, you can ask them questions. You can pull out that note sheet and say, oh, you know, I had a question on that one patient. Why did we choose this antihypertensive instead of this one? Or I noticed you asked this question and I haven't heard that question before. What was the intent behind that? And then before you leave every day, you ask, how can I help? Or is there anything else I can help with? Is there anything else I can do? And what should I review tonight? And they may not give you anything to review that night, but luckily you have your list of things that you know you've seen that day that you need to review or you've talked about or things that have come up. And if you don't have any of that, you have our syllabi to look back on, right? And know that you have reading assignments in there. And then summarize. Okay, so I'm gonna read up on kidney disease tonight, and then we'll talk about it tomorrow. Feedback. Not all of our preceptors are equally skilled at giving feedback. I will say in my role, some of the most challenging situations I've been in have been when a student has failed a rotation and they were not expecting it, right? And so the preceptor calls me to say that they're failing the student because the student was unprofessional, disinterested, didn't have the medical knowledge. For whatever reasons, they're failing the student. And then I call the student to talk to them and the student is shocked. That is heartbreaking. That should never, ever, ever happen. It is our preceptor's responsibility to give you good feedback, but it's your responsibility to ask for feedback. I recommend asking for feedback as often as you can, right? If you can ask for feedback at the end of every day, that's fantastic, right? I'd love to get some feedback about how I did today. If your preceptor is really busy, then that's probably not the best time to do it. Maybe you wait and just do it once a week. So how did I do this week? I really want to do well on this rotation. What did you think that I did well? And what do you think that I could do better on? Or maybe you identify something about yourself. I know it's been taking me a really long time to do my H&Ps. So one of the things I want to work on is just being able to get through that faster. Is that something that you think I should work on? Or I know my presentations have been not as smooth, so I think I'm going to start working on those. Is there anything else you think I should work on? Right? Ask for that feedback. Don't have it be a surprise at the end of the rotation that suddenly you're not passing the rotation. Ask for feedback as often as you possibly can. And do what you say you're going to do. Another hugely disappointing thing that happens all the time is you'll work with a student. The student will say, you know, maybe you ask them a question, like, what do you know about varicella? And the student will say, I don't know much, but I'm going to look it up. And you say, okay, great. And then the next day you see the student and you're like, so what do you know about varicella? And they go, oh, I didn't get a chance to look at that. Make sure you actually do what you'll say you'll do. Right? Make sure that you are being a reliable team member. Make sure that you are showing your preceptor that you want to learn and that you are actively learning. I have only ever had, out of the hundreds, thousands of medical students I've worked with, I have only ever had a couple students who do this. but it has blown me out of the water every time. Where not only will they come back having reviewed topics that we talked about, right? And maybe I didn't even say, I want you to go home and learn about that. They'll just go home and look up something that we had talked about or came up in the clinic day. And they'll come back with pertinent articles, right? Like, oh, so I looked up, that case, that interesting case we had about the brain tumor patient. I looked up about brain tumors and I found this recent article that states this, this, and this, right? Suddenly that shows me not only is that student really engaged, but they have that implicit desire and ability for lifelong learning, right? They're going to keep learning and they're going to teach me, right? Hugely. It's so, so, so impressive. And learn from everyone. Another very off-putting thing that some students will do is they will see themselves as better than, right? They will place themselves in the medical hierarchy just below the preceptors. And so they will talk down to the nurses, talk down to the medical assistants, right? That is horrible. That is not being a good team member at all. Be kind to the nurses, right? The nurses are the ones who most often are going to teach you a lot of the procedures. Nurses do a ton of procedures that you still need to learn about. So be kind to the nurses. Ask how you can learn from them. Ask how you can help them, right? I used to bring in, at the first day of every rotation, I would bring in some kind of baked good, and then I would also bring it in at the end just to say thank you. But if you set that tone from the beginning of the rotation, right? Like, I'm here to be a team member and to learn from you, you're going to get so much more out of that rotation, right? The nurses are going to be the ones that are going to kind of give you the background tips about your preceptors. Like, oh, they're in a bad mood today. Maybe you want to avoid this. Or they really like to talk about this subject. Why don't you bring this up? Or they really like to have this ready for them before they go in and see a patient, right? They're going to be the ones that are really going to help you the most. Yeah, the nurses are going to teach you. They're going to teach you how to do EKGs. They're going to teach you how to do IVs. They're going to teach you how to do blood draws, catheters. The nurses can teach you so much. So have that willingness to learn from every member of the team. Letters of recommendation. So when and where should you ask? Really, on any rotation where you feel like you have connected well with the preceptor, you should ask. If you know that you are interested in that specialty field, even during the first week, you can tell the preceptor, I'm really interested in general surgery, and I'd love to be able to get a letter of recommendation at the end of this rotation. What can I do to help you write me a strong letter of recommendation, right? Maybe you can do some extra presentations. Maybe you can work a few extra shifts. Like, what can I do to really stand out? And same with honors. I actually really like it when students tell me up front, I would like to get honors on this rotation. What can I do to help you see that I'm worthy of honors? Right? And then I'll start thinking about it. Okay, oh, well, then I want you to do these presentations. I want you to see this many patients. I want you to be able to write a note in this amount of time. And then you have those really clear expectations. The best way to ask for a letter of recommendation is to ask, would you be willing to write me a strong letter of recommendation? Right? I have gotten letters of recommendation from preceptors who I got along well, very, very well with. And their letter of recommendation has said things like, she dresses professionally, which that's great, but that's not saying anything about how hard I worked or how much I did, right? You don't want just any letter of recommendation. You want a strong letter of recommendation. So ask for it. Would you be willing to write me a strong letter of recommendation? I always recommend, right, and this is almost any time that you have to make a request, that you praise them, right? I have learned so much from you on this rotation, or I am really enjoying this rotation. Make it authentic, make it be something that is true, and then you make your request, right? So I have learned so much from you on this rotation. I'm really interested in this field of medicine. Would you be able to write me a really strong letter of recommendation? And how can I help you do that? Can I give you my CV? Can I give you a list of things that I've done in medical school, right? Some preceptors may ask you to write your own letter of recommendation, which is a beautiful gift, because then you can write a fantastically strong letter of recommendation. I put together a letter of recommendation guide that I encourage you to look through. You could even give that guide to your preceptors if they're not feeling, you know, very strong in their letter writing abilities. But in there, I even have a sample letter that I have written, and you can absolutely plagiarize that, right? Use sections of it verbatim as you feel like it fits for your letter. But don't be afraid of writing your own letter of recommendation. Yeah, so praise, I really appreciate your teaching style, something that's authentic. Would you be willing to write me a strong letter of recommendation? Is there anything I can do to help with it? And know your resources, right? So we have done a great job putting together all of your resources in a single location, right? And that's that Canvas organization, the TU Clinical Education Resources. Know all of the members of the Clinical Education Department. We have a ton of them, and we are all here to help you. And then there's all the other services on our campus, right? You're going to be away from campus, but they are all here to help you too, right? Our registrar, our bursar, right? A financial aid office, you can still talk to them. Our counselors will do phone and Zoom appointments with you, even from a distance. Right? Doesn't matter where you are, you can still connect with them. Our learning specialists, our librarians are amazing. So if you are doing research on a particular topic, and say you find an article, but you can't access it because it's behind a paywall, right? It's asking you to pay money to access the article. Send the name of that article, the information about that article, to our librarians. And within a day or two, they're usually able to send you that article so that you can access it. That's something that a lot of our preceptors find incredibly helpful too. We have so much available to us through our library. So get very comfortable with using it and with communicating with our librarians about what you need. And then if you're unsure of what to do, right? You're just finding yourself kind of lost and, oh, I just don't know what to do and I don't know how to get out of the situation. Come and talk to me, right? No matter what, even if I have moved positions, I'm still here for you guys. Come and talk to me. Come and talk to anybody on our team. We are all absolutely here for you. That's all I have. Thank you all so much. Please don't hesitate to contact me with any questions. I know you guys are going to do fantastic out there. And I know that this is a very unique and different situation that you're heading out into. So please don't hesitate to talk to us about everything. Have a fabulous day.